Hello, everyone, and very welcome. Thank you for joining in. So we are Adi and Dana. I'm Adi.
Some of you know us, and we've been helping through the years hundreds of kids overcome many of the challenges they face.
Yes, so we are located in London, in UK, and we've been using Neuronic helmet for quite a while, and we are really happy to have Jordan with us today. She will answer questions and she will talk about neuronic helmets and the way they can help kids with autistic, ADHD, and learning difficulties to function better and feel better.
Wonderful. Thank you so much. So I really appreciate you all being here. So just to give you a little bit about myself, I am a consultant with Neuronic. So I work with both our clinicians and our end users to understand transcranial photobiomodulation and to develop individualized protocols. I started my work in 2016 doing neurofeedback, and then when COVID hit in 2020, I began researching light, and for the past 6 years, that's been where my focus is. So I have the intersection of EEGs and light therapy as well. So for our agenda today, we're going to start off with what neuronic devices are, how this could be helpful for your child, the safety aspects, and how do families get started. At the end, we will have time for questions and answers, so if you wouldn't mind just holding your questions until the end, that would be much appreciated. So first, to start off with, what is light therapy? So light therapy or phototherapy or low-level laser light therapy, these refer to the use of specific frequencies of light to support health and wellness. Photobiomodulation, which I'll be referring to for the rest of this, typically refers to red and near infrared light, whereas phototherapy usually refers more towards that UV or blue light. So down here on the bottom, we have that electromagnetic spectrum, and you can see where that infrared light is down here and the visible light. They're right around each other, just getting into longer wavelengths. So the types of light therapy that exist, there's two types here. We have lasers. Often these are handheld. They have high intensity output. They tend to be used in clinical settings, and they do have a higher significant heating risk. So these are ones you might be using with a medical provider or that you're working with while you're in a clinic. The other side are LEDs. These can be handheld or larger, even sauna-sized ones. They have a lower intensity output, but this is what allows them to be more flexibly utilized in a clinic or at home. And they have a very low heating risk so that it is something that's much safer. For our devices and for a lot of these home use devices, you'll see them being LEDs. The light does come in these different forms. So as I mentioned, we have that visible light with red and infrared light, which is outside of that visible spectrum. This is something that we already get from the sun anyway. So about 40% of the sun's light is visible light and 50% of it is infrared light. So this is a natural thing that we're already exposed to, but in the modern times, we've moved indoors, so we spend a lot less time in the sun than we used to, which means those natural benefits we used to be receiving, we're not getting the same amount anymore. Especially the older someone is, the less time we tend to spend outside, or if you're in a heat wave, limits your exposure outside. So what are these benefits that we might be missing out on? First is reducing inflammation and waste removal. So there's a lot of different conditions that are associated with inflammation and neuroinflammation in particular. We see this coming up often with autism spectrum. We can see it come up with any brain injuries or even illnesses like COVID. And so we see that photobiomodulation can help to reduce this inflammation by increasing circulation, allowing more of these cells to receive the nutrients that they need, which can in turn just increase more of circulation. The next thing that we see is the sleep optimization. So I'm sure any of us here have experienced dealing with sleep issues, and certainly we can run into that often with children too. So infrared light has been shown to boost that sleep depth first and also length of time, on top of which helping to support that lymphatic drainage while we're sleeping, which can help to remove any of these toxin buildups. This can also increase cellular activity. So sometimes our cells might not have been getting the right nutrients. They start to become a lot more dormant. This is where we run into issues like with our ability to regulate speech, learning difficulties, attention. So photobiomodulation can help to energize these cells, wake them back up so they can begin doing what they're supposed to be doing. And then this can help also along with repair and regeneration. And finally, this can enhance brain functioning. So improving the cell's activity, improving the circulation can overall downstream help to improve things like focus, memory, and mood. So I just wanted to highlight some studies that have come up around this. This first one is one that was with children diagnosed with autism spectrum, and they were between the ages of 5 and 15 years old. So about this study, there were 21 participants in this. This was over 6 months of treatment. They were in particular using 2 protocols. These are 10 hertz and 40 hertz. I will explain more about this towards the end of it, so don't worry about those numbers right now. The results from doing this was a decrease in their CARS scores, reduction in behavioral and cognitive rigidity, and improvements in sleep quality. So this was a huge deal, obviously, because this reduced a lot of parental stress. It was a reduction in non-compliant behavior, so we're having a lot less arguments with their children, and there's improvements in attentional function, so better outcomes for classroom settings as well. The next study I'd like to talk about is children who were diagnosed at the ages of 2 to 6 years old, so a younger crowd with this one. This was a randomized control trial with a sham setting, which is the gold standard for research. And there were 30 individuals in this study. They were using a 40 hertz pulse rate, which again, I will go over towards the end of this. They were only doing this twice a week for 8 weeks. So this is just 16 sessions in total. The results that they saw were, again, that decrease in these CARS scores at a statistically significant rate, a decrease in the power of delta activity and an EEG. And what we see with that is delta activity is really associated with deep sleep. So not something you really want to be seeing often while somebody is awake, especially not if they're engaged in a task. So having this decrease in this delta activity was an indicator of increased cognitive performance. And I think a very important aspect of this study is no moderate or severe side effects were reported. And the worst thing that we saw was some overexcitement, headache, and irritability. So I think it's pretty incredible to see with only 16 sessions total, decreasing the severity of symptoms and that increase in attention and alertness. But those were 2 studies done with 2 other devices. So I'd also like to bring one up that was done with our device in particular. This is a case study of CCK. Is a 5-year-old who was diagnosed with autism. He had limited communication, both expressive and receptive. So he would mix up his teachers' names. He had 2 different teachers he would see each day. He would mix up their names. He wasn't able to express what he wanted or how he felt. So if he wanted a glass of water or he needed a snack, it just resulted more in that dysregulation and a breakdown rather than that communicative language. And he appeared to not understand instructions. So the teacher over here on this right side, the teacher had given him an instruction to draw dinosaurs and had given him an example of them. And this was his first attempt at it. After 3 months of once a week using this helmet, he was able to correctly name his teachers. He appropriately said hello and goodbye to them. He was able to express what he wanted, so saying water or snack. And he was able to express emotions such as frustration over not wanting to play with his brother, which at least he's expressing, that's what matters. And down here, this is just after those 3 months. This was the second time of him doing the same exercise of drawing a dinosaur. So a massive improvement from that previous 3 months difference. Down here at the bottom, this is just showing the QEEG and really without having to go into all of these details, what we're seeing is improvements in functional connectivity. So a lot less of this kind of hypercoherence that was occurring in slow frequencies, a lot more working together of the different areas of the brain. I do want to mention, because outside of just looking at a diagnostic side, I think it's important to look at some of these comorbidities, and sleep being certainly one that we run into often. So sleep disturbances, as we know, are associated with higher daytime behavioral issues. which can be irritability, hyperactivity, social withdrawal, or stereotypical behaviors. These are things that can interfere in the classroom setting. They can also just make it difficult being out in public as well, but obviously are just generally discomforting and for the child to deal with. Parents report higher levels of stress as well when sleep disturbances are present with the kids. As we know, if your kid's not sleeping, you're probably not sleeping either. This is not a great cycle to have that can certainly feed on itself. A big outcome from this lack of sleep is that we see an increased concentration of inflammatory markers. So this is increased neuroinflammation that is occurring. Again, that neuroinflammation can break down functioning, making it harder to do what you're trying to do and can feed on itself. And that poor sleep quality has been associated with lower brain volume. So over time, that just makes it harder and harder for the brain to do what it's supposed to do. As I mentioned at the beginning, studies have shown that research that PPM can be helpful for improving sleep quality. And there's a couple of different ways that this has been looked at, including an insomnia severity index, which is a questionnaire, but also wearable trackers and data we've been able to see as well. And then, of course, any reports from a parent. So this photobiomodulation can also help with down-regulating inflammatory markers. So as I mentioned, poor sleep quality can lead to an increase of these. Photobiomodulation can help to mitigate some of this. So we also help to restore some energy during the day afterwards. And then we also have seen in studies that photobiomodulation may help increase gray matter in the brain. So we're seeing this growth also occurring. That can be really important if you've been dealing with sleep issues for a long time, helping to get some restoration from this. Just some other notable benefits of photobiomodulation. In studies, it's been seen to help reduce obsessive thinking, reduce tantrums, improve ability to handle places with excess stimuli, like school or restaurants, and has improved handwriting skills. And these depend on the individual. This is not necessarily the case for everybody, but this is what's been shown throughout studies that have been looking at individuals diagnosed with autism spectrum. So I think it's an important time to bring up, is this safe for my child? So photobiomodulation, in particular with LEDs, is considered well tolerated by most individuals. We're really taking away the heating factor when we're using LEDs versus lasers. So you have a higher safety range, essentially. And studies have been conducted with children as young as 2 years old using photobiomodulation, although they use light therapy for even newborns who have jaundice. They use UV and blue light. So while the studies have only gone down to 2 years old, we also do see that there's likely benefits for even younger ages as well. For dosing for children, since they are younger and especially more plastic than adults too, children tend to need a lot less time than adults. Sometimes they just need 1 to 2 minutes of using this. That's really great if your kid wants to be running around and playing and doing things. Fitting in 1 to 2 minutes is a lot easier to get them to sit still through versus if you're having to do it for 20 minutes or 30 minutes. There are a few known contraindications to bring up. There's very few, but the two that I think are important are active cancer. We don't recommend using light therapy as it can be something that can promote blood flow to a tumor. And if there's metal implanted in the head, whether that be through an accident or through a medical procedure, the metal could potentially be heated. Other than that, there's very few contraindications. I didn't put it on this slide, but I would like to just stop and take a moment to say epilepsy is not a contraindication. This is actually something that in studies has been shown that photobiomodulation can be helpful for this in reducing the frequency, the duration, and the intensity of seizures. On top of that, using it in between seizures can be helpful for repair and restoration from any damage that was done from the seizures. So right now they've been doing multiple studies. One is being done in Texas right now. I'm looking at children who were hospitalized with epilepsy, and they were getting really amazing results using our helmet specifically. I'm happy to talk to anybody more about this if they need, but I wanted to be able to mention that here. So with neuronic devices in particular, your device will come with 4 preset protocols. It may look like this, but depending on which device you get, they might look slightly different. It doesn't change what those preset protocols are. These 4 preset protocols have the most research behind them. That's why we chose them. We also kept them at a relatively short time in duration so that we're getting as much as we can in the shortest amount of time possible. So just to point this out, as I mentioned, the younger that a child is, then they typically only need 1 to 2 minutes. You can do that with any of these previous ones. You can just watch a timer and stop it afterwards. But we also have an option with neuronic devices that you can add custom protocols. And this way, if you wanted to add one just specifically for your child, you could add in a custom protocol, title it your child's name, and just make it 1 minute or 2 minutes long with the particular settings that you're looking at. Usually for kids, we're looking at using the helmet maybe a maximum of 3 to 4 times a week. It does tend to have better outcomes if you are doing it at home as well, so in between therapies to help maintain those changes. But 3 to 4 times a week is the maximum, and with that, that's once a day. It can be used in the morning, the afternoon, or the evening, so it can really fit in your schedule. I know with a lot of parents that the mornings are just way too hectic to add in something, even if we're just doing 1 or 2 minutes. That's okay. We understand that. You can use it after school as well, or there's often a lot of parents that are using the helmet in the evening with their children to help support sleep quality. The most common protocols that we see from these glow would be the most common protocol. This is just constant light. So you're just having an even constant delivery of this 1070 nanometer light. And this can be really great for general wellness, and especially if there's any knowledge of neuroinflammation that's occurring. Peace would be the second most commonly used protocol. We use it often for supporting the nervous system, getting it to settle back down. This can be helpful if you just see the child kind of running on that edge a little bit on the anxiety side, or even just with sleep, having difficulties winding down in the evening. Again, we're just looking at a couple of minutes of this, especially the younger that a child is. Finally, there's a protocol called Focus, and this is a really good protocol to use earlier in the day if you're looking at having a child supporting either their schoolwork while they're in school or homework possibly once they get done with school. And this has been used in a lot of different studies, and Dr. Richard Fry is actually one of the top researchers with autism spectrum, and he uses this Focus protocol for his kids. The only thing I bring up is sometimes if you use it at night, it could keep somebody awake, but otherwise, that's a really good choice for the morning or the afternoon. And just again, as I mentioned, that custom program can be utilized to create shorter sessions for any of these preset protocols. So for instance, that focus protocol is 6 minutes. You might want to use a custom program to create just a 2-minute protocol for this. So I wanted to be able to offer an opportunity for anybody to learn more, and please feel free to take a picture of this. I'm happy to meet with you to discuss what's going on with your child in particular. There is not just a single protocol for everybody. It just depends on what the individual has. These 4 presets that we have that I showed earlier, those are the ones that have the most research around them. In general, that's where people are going to fit in the best. Figuring out which one is the right one for your child or for yourself does depend on what you're really we're looking at increasing attention and focus. That focus protocol might be a better option for it. If we're really looking at trying to calm that nervous system and supporting sleep, that piece might be a better option. The best thing about this with light therapy is we have such little risk. In general, that worst outcome is maybe a headache or maybe some hyperactivity, but we're not looking at anything that can be dangerous. So I'm happy to speak with anybody if you'd like, and I do have these 30-minute consultation windows. You're also welcome to just email me, and this is my email address that's on here. Our website is here as well. We have a lot of research that's on there, additional resources that are on there for particular conditions or focuses or just kind of general wellness information. It also goes more into the science if you're interested in learning more about that. We have a lot of information regarding the science on our website as well. And finally, I appreciate that you all were willing to attend to this. I do have a code in case anybody is ready to purchase. We have a code Hopeful Neuron, and this will give you $100 off of your device. I would also recommend that you take a picture of this, keep it for your records so that you can look back for it. And we do have Addie's email address that's down here on the bottom of the screen, is willing to answer any questions that you have as well, or discuss more about your child's needs, any other additional services that they might be able to offer for you as well. Thank you.
I think the most frequent question that we get asked is about epilepsy and the use. I know you've touched on it, but if you can elaborate a little bit more.
Absolutely. So one of the principal foundations with photobiomodulation is helping the brain reach homeostasis. So in particular with epilepsy, we kind of see what we call an excitable cortex. So it's sort of revving, always kind of active until we have this discharge that comes off, and that would be the seizure activity. What photobiomodulation is here to do is to help regulate this activity. So while I mentioned earlier on, it could be helpful for some slow waves, it could be helpful for fast frequency activity, which is what can lead to these seizures. Having an ability to calm these down so that we can have more regulation of this is where we have that decrease in that frequency and the duration and intensity of these seizures. The other important aspect with photobiomodulation is we're not in a visible spectrum at all. So it's not like the flashing strobe lights that you run into at different concert halls or whatever else it might be. This is invisible light, and we are applying it to the head. It's not over the eyes anyway. So even for individuals with focal seizures, then we don't see anything being triggered with this. We have multiple people who do work with individuals specifically with epilepsy as well. So if you're looking for an additional resource, Neuronic is happy to help provide that too, just to help give some more information. I can tell you for myself, though, in my experience working with this company, it's been pretty amazing to see. We've had quite a few of these kids who had seizures, and having the helmet with them has helped them to just be more present, especially for individuals who were maybe on medications that had zonked them out a little bit and they were struggling to have focus and attention. It's been really helpful for that energy aspect, but also just that supportive in between any activity that happens.
Thank you. And another question that we get asked is the differences between the red light panels, for body panels, and the helmets.
Absolutely. So in general, for anything that you're purchasing for those panels that you're mentioning, they often are red light and maybe near infrared light, typically in the 600 nanometer range to the 800 nanometer range. These frequencies are chosen because that red light at that 600 nanometer range can penetrate about skin deep, so it can be helpful for skin conditions. You'll see a lot of women who might be using it for wrinkles, but it can be helpful for other things as well, including like psoriasis or otherwise. And then you have the 800 nanometer range, which can penetrate more deeply, can be helpful for muscle in particular. You can also get some benefits for the gut. And these are really great frequencies for the body. Once we're looking at the brain, though, you have a lot of different layers that we have to get through. There's hair, there's the scalp, the skull, meninges, and then you get to the brain tissue. For that reason, these lower frequencies don't have as great of an ability to penetrate through all of those layers. They tend to scatter before they are ever able to reach the actual brain tissue. That's why Neuronic chose to go with the 1070 nanometer range. This is a longer wavelength with a lower scattering rate, and this is what allows it to be able to penetrate more deeply into the brain up to 5 centimeters.
Thank you. Okay, we would like to open it up for questions.
Anybody has any questions?
I have a question. We've talked a lot about autism today, and that makes sense because you're looking for probably some statistical significance. Have you seen or done any studies on children with structural abnormalities? So things like agenesis of the corpus callosum or chromosomal disorders. I'm just curious if that's been explored.
It has not, and I'm hoping in the next year or two that there will be a lot more conditions that'll be looked at. To be honest, there is a ton of motivation for photobiomodulation research leading up to COVID and amazing studies that were starting, and COVID really put a hindrance in all of that. A lot of them are starting to pick back up now, so we're getting more of those results that are coming faster. At this point, there's over 12,000 studies looking at photobiomodulation, but there's not any that that I know of at this point in time about structural abnormalities. I think it would be helpful, but it would depend on what it is. Since we're increasing blood flow, that would potentially be a benefit. It could also be something that could be a hindrance. Nothing that I know of yet.
Thank you. There's a question in the chat. Hi there. I'm interested to know if the helmet could be used on post-stroke patients who have shunts, especially the VP shunts.
I'm not sure if the VP shunt, if you're saying a medical grade plastic, is that what the VP shunt is referring to? If it is that, then it seems to be fine. We don't see any issues with it. There's a potential that maybe the plastic helps to deliver more light through there. So maybe you would do something that would be less intense for it. But as long as it's not metal, it's okay to have. There is a thing to note, though, is if this person has a shunt put in, because there was also a brain bleed with it, we do recommend waiting 3 to 6 months out after any injury with brain bleeding, just because we're wanting to get that full amount of repair before we're increasing blood flow again. Don't want to go through where there's any risk of blood vessels being weakened, and then they could have that increase of blood flow. It wouldn't be ideal for it. There are multiple studies, though, looking at post-stroke as well. They've looked at both targeting the side that was impacted, targeting the whole head. Both of them showed outcomes that were positive from it. So I think it's a really good resource, and it is something I work with regularly.
Okay. And there's another question about children with pandas.
Yes. So I work a lot with children with pandas. I really enjoy working with that population. And we've seen really great things. So moving away from those flare-up meltdowns that have been seen. We've heard a lot of stories. We've seen some really great outcomes. We actually have an article that will be published hopefully this year. It was accepted, but we're waiting for the actual publication date. That was a case study with our own device, but I think there will be additional ones as well that will come out with our device and with others. I think it's a really good resource to get really good feedback from it. And for that population, most of the time I'm using that glow or the piece just as it is. It's been really amazing. Oh, and a big thing, I've seen improvements in sleep in particular. I've run into a lot of sleep issues with pans and pandas. So I think it can be really helpful for calming that nervous system and settling things back down.
I gave it to my mom, who's 85, to try it. And first time ever, she slept without any sleeping pills. So
amazing. I think that's such a huge impact because we know how much sleep can impact. It can dysregulate kids. It makes us poorer performers at our jobs, but over time, having that lack of sleep just builds up. You have a lot more risk for cognitive decline. So anything to support sleep, I think, is a huge deal.
Yeah. And another point to add is that most of the kids that we see have problem with the nervous system. So the nervous system is all the time fight or flight, hypervigilance, and they just can't switch off. And after using the helmet, we see major changes. So they're much more calmer, and we can really make the best out of the therapy that goes after.
Yes. And we start the therapy with the helmet.
Yes.
And with the nervous system before addressing any other therapy like primitive reflexes or something else. So it's first helmet, then therapy.
Then therapy after that.
It can be a great primer for other therapies, and certainly with other neurofeedback as well. We see a lot of providers using it before sessions just to get a child calm enough to be able to do these other therapies. So I think it's a great choice to add in.
There's another question. Which protocol should be used for CP kids?
So at this point, there's only one study that I know of. So if we're just going based off of the research, then GLOW would be the protocol. I actually think that any of them might work. I would say PEACE would be a really good option in my mind. Potentially there's other ones too, but if we want to just go off of research, then constant light is the only thing that has support behind it.
Will it be effective for speech delay and also for hair loss? If
Love that.
Very different conditions.
Oh, yes. So it depends on the child and what the reason is for that speech delay. If it is more of this functional connectivity issue in the brain, that might be one thing, versus if we're looking at motor skills, that might be something else. Really, those might just require different approaches. So it's really helpful to work with a clinician like Hopeful Neuron to be able to help guide this and tailor these protocols for you. And then you can be able to take it home as well. So yes, that has been shown to be helpful for some of those individuals. It just depends on the root cause. For hair growth, that is definitely not the intention of our particular device. Because we're at a longer wavelength, we are penetrating more deeply into the brain tissue. However, I will say that reducing oxidative stress can already be helpful for any system in our body, and that can include hair growth. So I have had multiple reports from people who claim that our helmet has helped their hair grow more thicker and longer. And also, I had at least two people now who said that it reversed their gray hair, which I have no way of saying why that would happen, but I think it's amazing.
Also could be related to the nervous system.
Right? Reducing that oxidative stress, you can have all sorts of positive outcomes from it. Which I would like to mention, since we brought up about the panels as well. You can use both systems. You can use panels for the body and the helmet for the head. We're having two different targets for that, in particular of where you're placing it. So they can be used either simultaneously or even just on the same days. You might just need to do shorter sessions for them, since those benefits can build on each other. But I do get that question quite frequently, is do I have to give up my panel to use the helmet? No, you can definitely use both of them. I tend to do both in conjunction because I deal with a lot of back pain. So it's always nice to get that relief from a red light panel and use my helmet as well.
My question for me, would it be more beneficial to use the helmet while doing any cognitive activity?
Yeah, so
Activation of the energy and everything that comes from the helmet and also the cognitive activity.
So again, that research is still limited, but what they showed, this was looking at an individual with aphasia after a stroke. And so they did a study looking at these with using photobiomodulation alone and using it at the same time as these speech language pathologist exercises that were given. And they had greater outcomes from that activation. So I regularly encourage people to try and do it at the same time as practicing some skill or something that would be activating that area of the brain. On the other hand, certainly the helmet could be used before doing any of those activities to potentially give more energy to the brain to be able to complete those activities, or used after them to help try and lay down that foundation that we were just training and working on. But I do think getting them simultaneously, you can get some really great outcomes from that.
Any more questions? You can type them in the chat.
I have another one. You mentioned balance as the kind of fourth mode, I guess. But then you said that one, and that's more on the vestibular side of things. But then you said that one wasn't, when I saw the most common modes used, that one wasn't the most frequent. It was the only one of the four that was listed as not as common. I'm just wondering why that is, and if there's the same amount of evidence to support that mode as the others.
Great question. So balance is the name that we chose for this because essentially it's a middle ground between the peace and the focus setting. So we called it a balance of that activation, but it's not necessarily related to that vestibular system. I do get that question a lot though, and I understand where that confusion comes from. So it does have the least amount of research behind it. There's not a lot that goes around it. I'll be very transparent. I'm the one who put it on the device because I like the balance program a lot. And I do have other providers who work with it. So we use it a lot for long COVID. And I can't really tell you why it's been working. It just seems to be something, 14 hertz is a rhythm we start producing at a pretty young age in our sleep. So I think it's a very inherently human rhythm. I do use it for some seizure as well, and epilepsy. Focus doesn't go well for epilepsy because the cortex is already hyperexcitable. You don't want to encourage more of that. So using the balance is actually a better option that we can still get a boost in some of that cognition without overexciting the system. And then I have people who just, they prefer it. They feel like the focus protocol is a little bit too much, almost like if you prefer coffee versus green tea, then maybe you would like the balance protocol more than the focus. But focus has the most research around it, looking at all different ages for it, including, again, from that ages 2 all the way up to 85 is maybe the oldest I've seen in a study. And so it's definitely the first choice, in my opinion.
Thank you. And there's a question about the price of the helmets and if there are payment plans.
Yes. So for the helmets, we have two versions of it. Our newer one, which I have put in the pictures here, this is our light helmet. Yes, I know that's confusing since it's all light, but this is light with capital letters. That's the one being held up here. Yes, I highly recommend this one. It has a lot of good coverage. It's just a global approach, so the protocols are simplified. This one is 1,795 US dollars. I should have looked that up to translate beforehand, but at least I can tell you the US amount for that one. We do have another model. This one I do tend to use as a clinical model. This one has the ability to program for quadrants independently, and I'll show you the inside of mine. So you have the back, the front, the left, and the right for this. This one is a bit more advanced. There's more customization and features with it. This is $3,395. Again, for most cases, going for that light is going to be the better option just because of that whole head coverage. But this one does have that ability too. It's just extra customization. For payment plans, we do have payment plans in the US for HSA and FSA. I'm unsure though about the other countries, to be honest. But yes, we do offer that at least in the US.
And there's a question. My daughter is 4.5 years old. Do we need a different size of a helmet or will any size work?
Yeah, for both of our helmets, we tried to make them as adjustable as possible. So for the light helmet, there's an adjuster in the back that allows you to tighten it for a smaller head. And in addition, we have pads that are included in there that can be adhesively to the edge of the helmet. So thus far, I haven't had any issues with too small of a head. Maybe if we're looking at, baby, then you might have to hold it. But I think in general, even by a toddler, they can fit into our helmets really easily. And for the one that I showed you, the other model, this one has a thicker strap that goes all the way around. And even for the tiniest heads, there's extra foam pads that you can stick in so it can still settle on the head. It doesn't need to be perfectly placed. So just to be clear, with light therapy, there is a direct but also a systemic effect from it. So even if the helmet is slightly tilted back or slightly tilted forward, you're still getting those benefits because of that coverage over the entire head. So it's mostly about the comfort level, and you definitely don't want it to be tight at any point in time. We don't want to restrict any blood flow.
I've got another one. I'm sorry, I've got so many. Dana said you probably know. Always have questions. So there any consultations that you offer, or like we need some troubleshooting support, or we're not seeing what we need to see? Do you offer that like consultation as part of the process, or do you just sell the device?
Yeah, so I am not a salesperson. So definitely I'm here to be a support for it. Neuronic is as a whole, we have a customer support team. So if there's any technical difficulties you run into, we're available to be able to troubleshoot for that. Our devices do come with a year-long warranty as well. So if you run into any issues, even after a couple months of something, then we would be able to fix that for you. We have additional warranty plans as well. But for consultation in terms of, yeah, we're not getting those results, you can certainly be working with Addie and Dana at, they can provide that guidance for you. We can help with that too. We could be a support for you. That's a kind of foundational component of Neuronic. We try to be as supportive as we can for anybody.
Okay. Okay, so I'd like to thank you all. How long has it been? How long has it been in the market?
So for neuronic devices in particular, we've been on the market since 2021, but light therapy has certainly been around for a long time. Other similar devices have been around about 30 years. But in terms of light therapy being used at all, one of the earliest times that we can see is in 1906 with Auguste Rollier in Switzerland, and he was using heliotherapy to help clients with tuberculosis. So it is not a new technology. We've just changed the way that we've harnessed that power with electricity and putting it into an actual helmet now.
All right. I think that if there's no more questions, we can wrap it up. And really thank you all for participating today, coming here and listening and learning. And we really like to support you. So if you have any questions, please forward them to Jordan or to us. Anything that you are not sure and not exactly know about, or you would like to get a second opinion, please let us know. We'd really like to help, and I hope you the way we did.
Thank you so much.
Thank you.